Hello all, I'm Dr. Bahid. I am first year resident at Family Medicine and Northern Remote Program. I just wanted to make this video regarding some of the questions in the group from IMGs regarding references. So it will be a quick video. If anybody would have any questions, please feel free to drop by messages and I would like to help them as soon as possible. So, first of all, regarding the references are mostly three, which the different programs want them. Now, there are many questions regarding these references. First of all, the main questions which I most of the time hear from IMGs is what kind of references are those, whether one type of the reference can I put into another program or no. If I am applying in the more than one program, can I use the same reference or no, same reference letter. So let me tell you, there are two type of reference letters. Okay, so one of the reference letters, I would say, that is a specific program structure reference letter. Examples would be family medicine. So all over the country in Canada, every family medicine program, they have their own structured reference letter. Second example would be emergency department. Most of the emergency department programs, they also have their own structured reference letters. Now, if we are applying into family medicine, we need that specific structured reference letter from our referee. Now with that reference letter, we can apply into any program of family medicine because we have the family medicine structure reference letter. We cannot apply with that reference into any other programs other than that specific program of which that structure reference is. Okay. Now there are other ones, like for example, if you are applying in emergency department and also family medicine. So family medicine department, your referee would have submitted some structured reference letter of family medicine. You cannot apply into the emergency, otherwise your application will be rejected. Similarly, you cannot apply in an anesthesia or internal medicine with that reference letter. Now the second type of the reference letter, they are the traditional references which are being written on the pages and they are being submitted by referees into their own online CaRMS account. Those reference letter are, again, I would divide it into two. So one, it depends on how you ask your referee. Okay, so once you will be submitting that traditional references online, it will give you two options. One is if you want to apply as a general one, like you can want to apply in any of the program with that reference letter, or you want a specific department reference letter. For example, if you are applying in anesthesiology, you want your referee to be discuss about your skills regarding anesthesiology, so you will be putting that option into as a specific program, and referee will know that okay, so this is my candidate wants me to mention all of the things which regarding anesthesia it belongs to, specifically psychiatry, because psychiatry is a totally different world, pediatrics is a totally different world. So those references, they need to be amended with respect to the skills of that candidate into that respective field. Now when we ask the referee to submit that with that specific department where you are applying, probably it will not be a good idea if you will be using the same reference letter to any other department. For example, if you ask your referee to submit in terms of your skills regarding the pediatrics, so they will submit everything and they will discuss that okay, I'm giving the reference for this lady or this guy with the name, and he has a very good skills in pediatrics, and I definitely give them a big thumbs up to go into the pediatric department likewise. So in that case, if you are using that reference letter in another internal medicine, that probably will not make sense and probably your application will be rejected in that case. Now the other way is to pick up the general. So in that general, what happen is you are asking your referee to discuss as a general way. You don't want to bother your referee for every kind of a department. For example, I have seen many people, they apply in more than 5 to 6 programs. They are applying in pediatrics, psychiatry, emergency, and everywhere, right? So in that place, the good idea would be to ask the referee in a general manner to give the reference, so that the referee would not be giving with each department, and they will not be mentioning specific department skills, but as a general whole, your interpersonal and all of CanMed rules kind of comments they will be discussing about you. So that reference letter you can probably apply in any of the program which has the traditional references method, again not the specific reference letter, because the specific programs have the specific structured reference letter that should be submitted as a separate single one. Okay, I hope that makes sense to all. Now, what I personally prefer is not as a general one. The reason is, in a general they are just discussing about as in your general skills, but in a specific program they will be discussing your skills more pertaining to that department. So it will be more helpful for you to get more points into the reference if you're asking your referee to submit reference onto that specific department skills. Second thing which I will tell you guys is always talk with your referee first. Okay, what kind of a reference letter you are going to submit, so they would have an idea what they are going to deal with. Like for example, you can tell them like, please Mr. X, please, or Miss X, submit as a general reference. I'm going to apply for 7 programs or 8 programs, different programs. So they will have this thing in their mind, and they will make sure that they will give you the best reference as possible. Now, other questions is which response to use for the program. So structural or traditional, I think I covered that, and can we repeat for the programs or no? Okay, some other questions is choosing referee. Okay, this is a very common concern too. Who are should be our referee, whether it should be a doctor, whether it should be a consultant, or whether it should be not. For this, I will advise you always go into the program description and see what kind of referees they want. Okay, many program descriptors, almost all of the program descriptors, they have written very clearly, like for example family psychiatry, for example, they are very particular in it, like whether this reference letter you are submitting, one of them, your referee is a psychiatrist or no, and they have clearly mentioned in most of them that please submit a one reference from a psychiatrist. Okay, so in that case you should have a one psychiatrist if you are applying in psychiatry. Family medicine, one should be as a family medicine. Okay, now there's no hard and fast rule that your referee should be a physician. Okay, it can be a paramedical staff too, nursing staff, or something like that, your managers who can actually talk on your behalf, like talk on whether your skills, how is your communication. I would say that if you are submitting a reference letter of in charge nurse, that will be a very good on your resume and your application. Reason is, nursing staff, they know many things about doctors and residents and clinical assistants and observers. They know many things about it, so they have spent a lot of time in their departments. So if they are giving some reference and it's a good reference, it really mean, because that's how the program directors will see that this person have huge interpersonal skills and they don't have any problem in managing with many other people, so that nursing staff is giving them good references, right? So, and secondly, one question which I never almost always get around is and it is specific to the IMGs, whether they should submit any reference letter from their back home or any physician or no. So for that, I would definitely say you yes, please at least submit one. Why? Think about it, you have worked like 5-7 years into one country or one city or in a one hospital in other than Canada. Now you have also mentioned that in your resume. Don't you want to see like how your work was? Don't you want to mention that into the program, that how your work was? Definitely, if somebody will be giving you reference, they will be discussing how his skills or her skills were over there in department. You don't want to miss that. Now the people who have been in Canada for long period of time, like 5 years, 7 years, or 10 years, or even more than that, if they are skipping any referee from their back home, is fine. They can submit it, all of the referees in their from Canada. But like for example, you have been in Canada for last 6 months or 1 year, why you don't want to mention the reference of, I don't see anything, like why don't want you want to submit that? So please go ahead, submit it. And Yeah, that's the main points which I feel. I think that it will be helpful regarding the references. um, do let me know if there is any questions. I can always discuss more about it, and then we can go from there. Okay, good luck everyone for your application. Okay.